Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be discussing how to take a wound culture, okay, and how to do it properly, because I see improper technique done all the time. And if this is not done correctly, then we are grabbing bacteria and treating bacteria that we might actually not even have to treat. So that is what we're going to be discussing. But first, if you could hit that subscribe button, it would be greatly appreciated, as it truly does help my channel. So let's get started. All right, so I'm going to go over the steps here first. So first, we want to make sure that the swab can be transported to the lab within 24 hours, okay? They are time sensitive. If you do not have it to the lab within 24 hours, it does need to be thrown out and retaken, okay? So then you're going to gather all of your necessary supplies, okay? So not only for just doing the swab, but you also want to grab everything you're going to need for removing the old dressing, for putting on the new dressing after the swab is done. Okay, you want to assess for pain. Is the patient having pain? Do we need to pre-medicate before this procedure? Now, the swab itself, it's not really painful, but in painful wounds, if somebody's already having pain in that wound, it is going to be uncomfortable, okay? So just kind of assess, see where their pain is at. You want to make sure that you have a clean working surface, okay? You want to keep the swab as sterile as possible, right? We're literally checking for bacteria in the wound. We don't want to be adding bacteria in any other way. Okay, you're going to explain to the client the procedure that's being done, that you need to be taking a swab and what it involves. You're going to position the client in a way that when you go to clean the wound, that all the fluid kind of runs out. You need to perform hand hygiene and set up your dressing tray, okay? Once the dressing tray's set out, you're going to put on clean gloves. You're going to remove the soiled dressing if there is a dressing there. Once you remove a dressing, you're going to take off your gloves, perform hand hygiene, okay? Prior to taking a culture, you want to thoroughly cleanse the wound with 60 to 120 mils of sterile saline or sterile water. Okay, you want to make sure that the peri wound is also clean. And then you're going to use a sterile gauze to remove excess saline from the wound base. Okay, touch into the wound, absorb, and out. That's it. Okay. You want to use that amount of cleansing saline for removing excess bacteria, okay, just surface bacteria. And we're actually moistening the wound bed to allow to actually pick up the bacteria, okay? So the wound has now been cleansed, and you want to make sure that there is a 1 centimeter area, okay? So 1 centimeter circle, square area that is viable tissue, okay? So this is your clean wound-based tissue, okay? Pink, reddish. That's what you want, granulation tissue, in order to continue with the process of actually taking the swab. If you do not have viable area to take a culture from, do not take the culture, and get a hold of either the ordering physician or nurse practitioner. Okay, so say we do have a viable area, which I'll show you in the next slide, different wounds and how they look and what we can swab, what we can't swab. Okay, so we do have a 1 centimeter squared area of viable tissue, so we are going to swab that area with enough pressure for 5 seconds, okay? You want to have some pressure on it so the wound is actually going to expel some fluid from it, okay? You want to avoid touching anywhere else, just that viable area You do not want to touch anywhere else because it could contaminate the swab. Okay, you're then going to immediately place the swab into the medium. Okay, so I'll show you here. This is a swab. Okay, so when you open it, you just open up the top. Okay, and kind of hold it like this. Now, this has a lid on it, and this is your swab. So I always crack this. Okay, so that's just on there gently. And then you take the swab out and you only want to touch that area. Okay, putting enough pressure on it where it's expelling. And you kind of rotate the swab on there, okay, to get it all over it. Now, if the wound is dry, okay, if the wound is dry, you want to stick this in the transport media first, okay, stick it into the transport media and then swab the wound, okay, so it'll give it a little bit of moisture. But once this is done, you take your pinky, you pull this off, and you put it directly into the transport media and snap it closed, okay, and then you have it like this, okay? So you're keeping this as sterile as possible all around. Okay, so you're going to remove your gloves and perform hand hygiene once again. You're then going to put on another pair of either clean or sterile gloves, whatever's appropriate, to complete the dressing change. Okay, and you're just going to do that as per the client's care plan. Once that's all done, remove your gloves, personal protective equipment. Once again, every time you take off gloves, you wash your hands. You're going to place this specimen in a biohazard transport bag, and you're going to transport it to the lab as soon as possible. Now, if this is for aerobic collection, you want to make sure that you're storing it in the refrigerator until it can be transported. And you always want to make sure that these are transported within 24 hours, or you have to discard it and collect a new specimen. So I wanted to show you some different wounds and what you can do here when you're swabbing, okay? So this first wound right here, this is non-viable tissue, okay? So you would not be able to swab this for a culture, okay? This is a medium for bacteria growth, okay? When you have slough, eschar on here, bacteria love it. They're going to be multiplying like crazy. You're not getting an actual culture of the wound itself, okay? So that, get a hold of the doctor. Over here, once again, you need a 1 centimeter area of viable tissue. If you can find that in the wound, you can swab it, okay? So here there is a area that I can swab, so I would swab that. I can also swab along here, okay? Just kind of going back and forth. As long as you have an area to move it, to roll the area, the swab, you can do it, okay? We have a fresh wound down here. It's a great wound base. Obviously, you can do that. Oops. Oh no. Where did we go? Go back to that. Sorry, guys. So, you see that this leg has 3 wounds, okay? So if you have wounds that are kind of clustered like this, or you have another wound that's super close, or even if it kind of like has a normal wound and gets a second wound here, swab it with different swabs, okay? You do one area of a wound and that's it, okay? And then you would do a different swab for other wounds. Even if it has connected, so say a wound started here and it connects, just do two separate cultures, okay? So I hope this video did give you a better understanding of how to take a wound culture. The most important thing here is that you're keeping the wound sterile and your swab as sterile as possible, because you do not want to introduce bacteria into that swab, okay? Other than what you're culturing off of the wound. In that we're cleaning the wound. I see this so often, and I've even seen a few videos on YouTube, and that's really what initiated me to make this video, because I was watching this one video and they did not clean the wound, okay? If you're not cleaning the wound, your body is literally putting out all this exudate. Like there's all this material on a wound that we can't see. We don't want to be swabbing that. We want a swab from the fluid coming out of the wound. That's why we apply pressure, because that's giving us a good idea. Bacteria is going to grow over top of a wound. We want to make sure that we are taking the sample from the wound itself and not just culturing over top of the wound. Because even our skin, we have bacteria on us. It's called normal flora. It's something that's always there. Okay, so when we're culturing, we want to make sure it's from the fluid that's being excreted from the wound. Okay, from the nice clean wound. But once again, that's all I have for this video. Hope you did find it helpful, and I hope to see you in my next one. Bye, guys.